everybody, it's Dr. Earle. We're here today at Pure Plastic Surgery, and it's Hump Day with Dr. Earle. As many of you know, this is the time we get to spend together and answer a whole bunch of your questions and go over several plastic surgery related topics, okay? And today I think we have what I consider probably one of the most important topics that we can discuss, which is how do you choose a plastic surgeon? Like, what are the factors that I think are important where you're going to choose a plastic surgeon, trying to find the best plastic surgeon, the best fit for you, okay? So there's actually multiple factors, and I've kind of written them all down here. Is any one specifically more important than the other? Not really. I just kind of wrote it down as it kind of popped in my head. So even though they're numbered, it doesn't mean that this is more important than this or this is more important than that. But I think actually all of these factors are incredibly important. And when you go to choose a plastic surgeon, you want to make sure actually that you hit every single one of these points, okay? So there's not any point in here that I think you can just erase and throw away, okay? So when you're doing your research, and I know a lot of patients do very extensive research. I mean, I've had patients that come in and tell me that they've been kind of researching for like over a year, sometimes 2 years, that they've been looking at me for about 2 years before they finally decided to pull the trigger. And I think that research is very important. Do I think it needs to be 2 years? No, I mean, that may be a little bit much. But just take whatever time you need in order to feel comfortable with your decision, okay? Especially if you're traveling, from a different state or a different country. You want to really make sure that you're feeling comfortable with that surgeon, that you understand that surgeon, that you feel comfortable with the practice and the place that you're coming to before you make such a big decision, okay? So let's start from the top. So one of the first things you should look at is that surgeon's education and training, okay? This is probably pretty easy. Sometimes just a Google search and you'll be able to find some of that. But you want to make sure that they've been educated and trained at some of the kind of the best places out there for wherever they're from. So of course, it doesn't necessarily only pertain to U.S. surgeons, okay? I'm going to talk a little bit more about that because it's what I have the most kind of knowledge of. But so for example, me, I'm Ivy League educated. I went to Princeton undergrad, and I did my plastic surgery training at probably what's considered the best, if not one of the best, plastic surgery training programs in the nation, which is, of course, who can guess? It's right on my forehead.
Duke!
It's Duke, that's right. I went to Duke Plastic Surgery, one of the best training programs in this nation, and so it's definitely one of the factors that you want to consider. Okay, but of course, education and training is not enough. Many doctors have great education, great training, but they may not have the experience that you want or that you need. And when we're talking about experience, we're talking about specifically to the procedure that you're looking for, okay? So for example, say BBL. So, at this point I've done over 2,000 BBLs. I would certainly consider myself having a very vast experience with BBL. And so I would consider myself actually kind of an expert in BBL, mommy makeover, breast, and pretty much breast and body work, okay? But say if someone, we're looking at, say, my rhinoplasty experience, I don't do that many rhinoplasties. Do I know how to do it, and do I think I can do it well? Yes. But have I done thousands of rhinoplasties? No. So if you really want to go to, like, say, the most experienced, one of the best rhinoplasty surgeons out there, okay, probably my name is not going to pop up in that list, okay? And that's okay. I don't have to be great at everything, but the surgeon that you choose should be very well experienced in the procedure, in the specific procedure that you're looking for, okay? So the experience is very important. And the next thing that we have here on the list, of course, is board certification, okay? I think board certification is extremely important because it tells you that the track that surgeon took, required, hit all the elements to make him a very good and safe surgeon, okay? Why? Because in order to become board certified in plastic surgery, you have to go through many hoops, basically, many tests, proving that you know what you're doing, that you know what you're talking about, that you're safe and that you're ethical. Okay, so for example, in my particular case, of course I did my 4 years of medical school, okay, but then I did 5 years of general surgery training, plus 2 years of NIH funded research. Okay, I'm board certified in general surgery, but then I went on to do 3 years of plastic surgery training, okay, And then once you do that, you then have to do a written exam. You have to pass that written exam. Then you have to do cases for about a year. You have to what's called the case collection period. Those cases are then reviewed by the board to make sure that you're an ethical and safe and good surgeon. Okay, and then after that, you do your oral examination, and only after you do all that is then that you qualify to be a board certified plastic surgeon. Okay, and then you're not done. Then you have to maintain that certification. Okay, so every year you gotta, and every 3 years you gotta go through further examinations, what they call continued medical education, credits, etc., to maintain your certification. Okay, so this pretty much is extremely important. And if you want to check if the surgeon that you're looking into is certified by the American Board of Plastic Surgery, then you should go to this website here. Okay, you're going to go to www.abplasticsurgery.org. Okay, once you get into that website, you're going to look, I believe it's in the upper right hand corner where it says there's a tab that says public. You hit on that tab, right underneath there it says verification. Okay, you hit that, you put the surgeon's full name, and they'll tell you what's the surgeon's standing. Is he or she board certified, and are they in good standing? Okay, so if you're gonna look me up, make sure you use my full name. I know I always go, I'm Dr. Alex Earle, but my first name is actually Stephen. So if you're gonna look me up, you go Stephen Alexander Earle. Okay, and you'll find me there, board certified by the American Board of Plastic Surgery. Okay, this is not the same as being board certified in cosmetic surgery. That's a completely separate thing. Actually, the Board of Cosmetic Surgery is not actually considered a true board by what's called the ABMS, which is the American Board of Medical Specialties. So it's not it does not fall under that umbrella. Okay, so it's not considered a true board. In order to be certified in cosmetic surgery, you can actually have a background in anything else. It can be gynecology, it can be just general surgery. You don't have to have specific training in plastic surgery, and then plus minus some cosmetic fellowship, and then you're able to have that board. But it's not, like, once again, it's not considered a true board by the ABMS or the American Board of Medical Specialties. Okay, so it's a very, very important distinction there. Okay. All right, so next on the list, of course, is the befores and afters. These are incredibly important. Not only that the surgeon has before and afters and that they are able to demonstrate good results, but the before and afters should be at different time points. So it's not enough if there's just on-table results, okay? Because things may look great on the table, but maybe they don't look so great, 3 or 4 months out. So you want to see before and afters that are on the table. You want to see them at, say, 6 weeks out, 3 months out, 6 months out, 1 year out. So you want to have the whole gamut of before and afters that you can kind of look into. And so that demonstrates that the surgeon is able to have long-lasting results. Okay. The other thing that's very, very important when you're looking at before and afters is the style of the surgeon, because not all surgeons have the same style. Okay, and it's very difficult to try to get a surgeon to do something that's different than their style. So, for example, my style, say for the BBL, is more of the kind of soft vixen, kind of enhanced natural look. I typically don't do like one of these like very exaggerated kind of video vixen types of looks. I don't think it's really possible to do that safely in one round, honestly. But they certainly have a certain style. So my style is like Earle curve, upside down heart. That's my typical go-to style. Can I tweak it? And if needed, I can. But if you're looking for something that's like a completely different style, then that may not be the best fit for you. Okay. So when you're looking at the before and afters, of course you want to look at beautiful results. You want to look at results at different times, okay? And you want to look at the style of that surgeon and make sure that you kind of fit, that your goals or your desires kind of fit within that style, okay? All right, very important there. Of course, I think one of the most important things, and I have that here right in the middle, is of course patient safety, okay? You want to go with the surgeon who is basically a patient-centric, patients come first. It's all about patient safety above pretty much anything else, okay? And it's not enough to just have the clinic or the surgeon just say it. Just say, oh, we're all about patient safety. Well, prove it. How do you prove that? What have you actually done? Okay, so for example, in my particular case, when we're talking about BBLs, I use the ultrasound. Okay, I use the ultrasound when we're transferring fat into that danger zone area because I want to make sure that the cannula is above the muscle, and therefore the risk of a fat embolus is much, much, much lower. Okay, the other thing that we do here, of course, is we have the cell saver. We use that for pretty much all our big lipo and BBL cases. Okay, we want to make sure that the equipment is all top notch, that the staff is extremely well trained. Okay, and so how do you quote unquote prove that? Well, you prove that with your OR certification, which is the next one right here. So who certified that OR? Well, we're certified by pretty much the highest level of certification that you can reach for an office-based surgery setting with it, which is the Joint Commission. Okay, so that gives you an idea that we've been surveyed by the Joint Commission. They looked at our processes, they looked at our equipment, they looked at how we sterilize our instruments, they don't just look at me, they look at the entire staff that's in there in the OR with the patient, okay? And they've determined that we are safe, that we are patient-centric, and that they've given that certification for our OR, okay? So this is kind of the proof, okay? You're not just talking the talk, but you're walking the walk, okay? All right, so we talked a little bit about the OR certification, okay, Joint Commission, the highest level you can get, okay? All right, so again, kind of within the same line of thinking, you want to go to someone who has a low complication rate. Now notice, I said low complication rate. I didn't say zero complication rate, okay? Because like most things in medicine, there is no 0% and there is no 100%. Okay, if you're busy, if you're doing surgery, okay, you cannot make anything 0% or 100%. Okay, that's just the way it is. Can you try to minimize risk? Yes. Can you try to minimize potential for complications? Yes. Can you ever make them zero? Absolutely not. Okay, the only surgeons that have a zero complication rate are surgeons that don't operate. Okay. And that's just a fact, okay? And that's just something that needs to be accepted. But you do want to make sure that the complication rate is overall low, that everything is being done to try to minimize that risk as much as possible. So, for example, you can look at, what are kind of nationwide, say, infection rates, okay? So, BBL is a procedure that has a higher infection rate than other cosmetic procedures because we're working near the anus. Of course, that has bacteria, and it's almost impossible to sterilize that area completely, okay? All right, so taking all kind of BBLs done in the US and throughout the world, the infection rate is approximately anywhere between 10 to 15%, okay? You guys have heard me talk. I give all my BBL stats towards the end of the year, and you know that our infection rate is much, much lower. It's kind of more in that 3% range, okay? 3% range. So is it zero? No. Is it ever going to be zero? No, that's physically impossible. Is it lower than the national and international average? Yes, and that's what you want to be looking for, okay? So you want to look for low complication rate, and that's very, very important, okay?
Quick question about your SOBI BBL. Is that the same as your regular BBL, and are you only doing the SOBI BBL moving forward?
Let me get to that in just a few minutes, okay?
Yes.
But let me just kind of finish my train of thought here, and I'll make sure to answer that for you, okay?
Mm-hmm.
All right, so the next thing on the list, which I think is incredibly important, is communication, okay? Are you going to actually be able to communicate with the surgeon, okay? Before, during, and after your procedure, okay? So you want to go to someone who is easy to reach, easy to communicate with. If you have a problem, you have an issue, you know that they or their staff are going to be right on top of it, okay, and that your email is not going to linger in some inbox for months, or that no one's, getting back to you, when you need them, okay? So, I'm a huge believer in communication. We spend a lot of time here, myself and our staff, getting back to patients through multiple means. We get back through social media, email, Crna, which is our HIPAA compliant texting system, of course, via the phone. There's always a call service that's available after hours and on weekends, pretty much 24/7. Okay, so we're always there for our patients. Okay, you want to go to someone who's there for their patients 100% of the time. Okay, because it's like I said before, it's not about zero complications. That's impossible. Things are going to happen. Things do and will happen, and when it happens, you need to know that you're going to be able to communicate with that surgeon. That surgeon's going to be able to take care of it as best as they can. Okay, and give you the advice and everything that you need to get through it. Okay, so extremely important there. And then lastly, but certainly not least, you want to go to a place where the entire team is there for the patient. Okay, we have an awesome team here at Pure. A lot of the patients who come here, they kind of rave about all the staff because they know that everybody here has the patient's interests at heart. It's all about keeping them safe. It's all about keeping them happy. It's all about communicating with the patient. It's all about educating the patient, okay? And every single staff member here has that as their primary goal because it's part of our culture. It's part of Pure's culture, okay? Because you can go to a place where, perhaps the surgeon has a lot of these things, but they're in some clinic where they don't communicate with the patient. They're not, they kind of rush the patient around. There's not a lot of education going on, okay? And then you're not going to feel good. You're not going to feel comfortable. All right, so you want to go to a place where pretty much every single staff member has been coached and educated as to how to make sure that the patients are informed, okay, and that they're comfortable at all times, okay? And that's what we do here at Pure. All right, so multiple things. All of them, I think, are extremely important. None of these, I don't think, are necessarily more important than the other, and I wouldn't take any of these off the list. So when you're doing your research, you want to be hitting all these points, okay? But notice there's one thing on this list which I didn't mention. Who's going to say it?
Anybody?
Price, okay? It's not about price. Okay, yes, of course, you have to consider it. All right, not everybody's bank account is the same. I understand that. Okay, I do understand that. But you're putting your life in someone's hands. Okay, all right. So that's the real deal there. So price should not be one of the initial factors that you're considering. If you have two people and everything here is exactly the same, then perhaps you can talk about price or location. All right. But it certainly shouldn't be kind of one of the top things that you're looking at when you're trying to figure out where to go. Okay. I would call that a secondary kind of factor. All right, so that kind of concludes the talk here. Like I said, all of these are very, very important. Does that mean that everybody out there has to come to Pure Plastic Surgery and Dr. Alex Earle? Well, that would be awesome. I would love for all you guys to come, but no, not necessarily. I mean, I think you should be looking at all of these for whatever procedure it is you're interested in, whatever country or state that you're at. Just basically for your research in general. So again, and remember, the experience, the style, all these things are very, very important. All right, so talking about style, and we'll get back to that question. We did launch the SOBI or the South Beach butt lift. Okay, we're not in Brazil anymore. We're bringing it back home to South Beach. Okay. And what we're doing there is that we're greatly reducing the amount of access points, especially in the back. Okay. And of course that makes it so that when you wear, a small bikini out on the beach, pretty much no one's gonna, there are no, no hints, no little scars. No one's gonna be able to tell whether you had surgery done or not, which I think is really, really awesome. I think a lot of our patients are really gonna appreciate that. Now, is it for everybody? Unfortunately, it's not. Okay, so it works best for our lower BMI patients, okay? So kind of BMIs like we're talking about BBL, like 22, 23, 24, okay? If we're doing lipo-alone where we can even go lower in that BMI, 19, 20, 21, it's gonna work best for the lower BMI patients, okay? Now, why is that? Because the lower BMI patient, of course, tends to have less fat, and B tends to be less wide, okay? So when you're using just one access point in the middle, I have to make sure that I'm able to reach everywhere that I can reach to then still produce, the great kind of Earle curve and the great results, okay? Because, of course, doing less access points and then having, less fantastic results, that doesn't do anybody any good, right? So the whole point is to do it with, so to have a less access point with the same great results, okay? And so in order to do that, the patient does have to qualify, and they do have to be on the lower BMI range. The torso and and everything else can't be too wide, because we have to be able to reach all the areas that we need to reach with those 2 access points.
Does this apply to your patients who are currently booked for the
Yeah, I mean, as long as the patient qualifies, then that's going to be kind of our go-to. And like I said, it's a different technique. I think it's certainly an upgrade in technique. And we're really excited about it. But like I said, not everyone's going to qualify for this. Okay, so if you have the frame basically that makes it possible such that it can be done in that manner, then it will be done. Okay, but if the frame for whatever reason is not, then if we have to make a couple more access points, then we'll do that.
And when searching for a surgeon, are revision rates an option to ask the surgeon specifically?
Yeah, I think that's fair. That's another one of these things where it's never going to be 0%, okay? Especially for surgeries that are more complex, or surgeries that have many factors that are not completely controlled by the surgeon, okay? So surgeries that have more steps or are more complex, of course, have a higher rate of revision. So for example, say you do what we call the trifecta. So if you're doing a breast lift, implant, tummy tuck, muscle repair, liposuction to the flanks and the waist, and the brachioplasty, that's a very big surgery with multiple components. And so it is possible that any one of those potential components will need some sort of minor revision down the line, okay? And then the other, of course, classic example is the BBL. So the BBL has many factors that are outside a surgeon's controls, like how much fat, what's the quality of the fat, how much did that fat get absorbed, did it get absorbed equally or not, was the patient fully compliant afterwards with their massage, their compression, was there any pressure, was there any sitting, skin quality, is the skin loose, is the skin tight, is it tight in the right places? So is it tight in the belly, but a little bit more lax in the buttock and hips so you can expand it? Or is it the other way around? It's way too loose in the belly, and perhaps you'll need a tummy tuck, and very tight in the buttock, and you can't expand things the way that you would like. So there's all these factors that are outside of a surgeon's control, which then lead to the potential for a revision. So, do I know any surgeon that has a 0% revision rate? No, it doesn't exist. It does not exist.
Is there a number that is alarming?
No. Is there? Yeah. What is the average? So it's part of this research. So when you're going to compare, you should compare to like national or international averages. Okay.
Mm-hmm.
So another thing I didn't mention here is like societies. Like, is a surgeon part of certain societies? Perhaps not as important as these 9 things, but I think it's something to consider. And for example, I'm a member of what's called the World Association of Gluteal Surgeons, okay? And of course, there's many advantages to be part of that society, but one of them is continuous education. We continue to learn and teach each other about new techniques and how to deal with potential complications and things of that nature. And we also get a lot of data. Okay, and one of the things that is done is that one of the data points that is looked at is revision rates, for example, the BBL. And so the international and national revision rate for the BBL, it's close to 15%. 15%. Okay, I'm running on the board here, but it's close to 15%. Okay, so anywhere between 10 to 15% is what would be considered a standard revision rate for BBL. Okay, so if someone has a rate that's higher than that, then that's cause for concern. And if someone has a rate that's lower than that, then that's kudos to them. Our revision rate last year was about 6%. 6%. Okay, so not 0. Okay, but lower than the national average. And when you're busy, okay, when you're doing, say for example, 600 BBLs in a year, okay, 6% is about 30 some patients in a year. So when people are there like, there's dozens of patients that have to go back for revision. Well, yeah, that's exactly right. There are dozens, about 3 dozen, okay? But you're not looking at the entire picture, right? If you're doing 600 BBLs, then that's only 6%, which is about half the national rate.
So just to go back on the South Beach BBL, what's the BMI that is perfect for that surgery? Is it 24?
Yeah. So yeah, it's going to be on the lower end of the BMI range for BBL. So it's going to be your 22s, 23, 24. And then once you get to 25, it's going to be plus minus. Perhaps some patients in the 25 range will be good candidates and some will not. Again, BMI, I do understand, and a lot of patients point this out. BMI is a crude measurement. I get it. It is a crude measurement. And you can look at 2 people that have a BMI of 25 and their body composition can be completely different. That's why when we're doing your evaluations, we don't just ask you for your height and weight and what's your BMI, okay? We ask for the photos. That's actually one of the most important parts of your evaluation. So when you go in to do the virtual consult through our website, yes, you have to answer all the questions. Yes, you have to give us your height and weight and everything else. But you have to send us photos, and it's best if those are like good quality photos, so that when I read everything and I look at your photos, I can make a proper evaluation and determine what's going to be the best procedure for you.
Is there a lowest BMI that you would accept?
For BBL specifically, typically the lowest is about 21. That's probably about the lowest, because we do need a certain amount of fat to be able to make a difference when we do the fat transfer. Which is not the same as, for example, if we're just doing lipo 360. Because if we're just doing lipo 360, I'm not concerned about how much fat I actually get. I'm just concerned about contouring the body. And a lot of those patients, they want to do like HD lipo. So you've seen a lot of those terrific results. We're doing a lot of high definition lipo. So we're defining the abs, we're defining the obliques, getting a little bit more of that athletic look, okay? And typically those are going to be lower BMI patients as well. So if your BMI says probably about 19, 20, 21, you're still a good candidate for a lipo 360 with HD lipo. And then once you get into like 22, 23, 24, you're getting to that BBL range.
So is a regular plastic surgeon good to do my BBL, or should I only focus on board certified?
So I would focus on board certified. I would focus on all these things. Mm-hmm. So everything I said here, certainly board certified in plastic surgery. Certainly that they have the experience with a specific procedure that you're looking at. So you're talking about BBLs, you want to make sure that they have an experience with BBL. Like I said, not all surgeons focus on things. So, if you're talking about, say, facelift, it may be a completely different, different surgeon that you're looking at, okay? If you're talking about rhinoplasty, again, there's a lot of surgeons focus, almost exclusively on rhinoplasty. If you're talking about BBL, lipo, body, breast, and body, then you go to someone like me, where that's kind of my focus, which is BBL, liposuction, breast, body work, tummy tuck, mummy makeovers, brachioplasty.
So we're seeing more and more cosmetic surgeons who do BBLs and other surgeries. Could they be a good option?
So, like I said,
or what's your opinion on that?
My opinion is I think that it's important to stick with board certified plastic surgeons. Okay, the cosmetic like I said, the Board of Cosmetic Surgery is not a recognized board by the American Board of Medical Specialties. That part's not my opinion. That's a fact. You can look it up. Okay, there's a big umbrella. It's called the ABMS, American Board of Medical Specialties. Okay, and that carries all the what are the qualified boards. Okay, so there's the American Board of Surgery, the American Board of Plastic Surgery, American Board of Pediatrics, etc., etc. Multiple boards all fall within that umbrella as the recognized boards where they're doing everything they need to do in terms of training and examination to make sure that the candidates qualify to be a part of that board. Okay. All right, the Board of Cosmetic Surgery does not fall under that umbrella, so it's not recognized by the ABMS. Okay. Now, having said that, is there a cosmetic surgeon who has everything else? Of course, that's always that could be possible, and maybe they have the experience, and maybe they've done 2,000 BBLs, and that's what they focus on, and they're good at doing that. Then I think it's you can consider that. Okay. So I'm just saying, but in general, my preference would be to choose a surgeon that's certified by the American Board of Plastic Surgery.
So we know every surgeon's different. They have their different policies and different ways they do things. We know you do 5 surgeries a day, so that keeps you fresh, and you do all your surgeries. Would you not recommend a surgeon that does 10 surgeries a day?
Yeah. So that goes into number 5, which I think is incredibly important. Okay, which is patient first, patient centric. Surgeon, patient centric clinic. Okay. I think doing 10 surgeries a day is just exhausting. I cannot imagine that you can put the same amount of effort and concentration on the 10th case of the day as you can, the first 2 cases of the day. Okay. And some people might even say, that doing 5 cases is a lot. There are surgeons out there that think that too. I think I try to balance things out as best as I can. I think I know myself. I know that I can do 5 cases and I can have the level of concentration that I need for all those 5 cases, even if there are 5 bigger cases. For example, say a mommy makeover and 3 BBLs and a tummy tuck. Okay, that's kind of a very, very classic common day that we do here. And I know that I have enough energy and concentration to get through those 5 cases. There might be surgeons out there that say like, "Oh, that's crazy. How can you do those many cases?" But I feel very, very comfortable doing that. But I think once you're getting into that type of number, once you're getting into like 10, 12, higher for something like a BBL, it seems to me that you do not have like the physical stamina and energy to be able to do something like that.
Is there something with your board certification, once you get it, is it with you for life, or is it something that you have to keep practicing every couple of years or something?
So you have to maintain it. So, and I mentioned that a little bit before when we were talking about it, but you have to go through what's called a maintenance of certification, so it's MOC, maintenance of certification process. And so you got to keep doing multiple things, multiple steps as the years go by to maintain your board certification. Okay, so nowadays the initial certificate they give you is good for about 10 years. Okay, but you have to maintain that certificate, and so you do that by accumulating what's called continuous medical education. So that means you have to continue to read the literature, you have to continue to go to meetings, you have to continue to stay up to date with all the latest information regarding plastic surgery. Okay, and then once you get to certain points, say like I believe it's every 3 years, you also have to take a more further written examinations. Okay, and you got to continue to pass those. And every few years as well, you got to send in your cases for them to be also evaluated to make sure that you're doing good, safe, and ethical work. And so you got to do all those things to maintain it. And then once you get to that 10-year point, you do a bigger examination to then be able to get your certificate for another 10 years.
All right, so before the next question, we have a few requests. Can you just slide to the left so some people can screenshot? They want to screenshot your board. Here, have your screenshots.
There you
Save
go.
that. Now, are any of these questions that are listed, would it be considered out of line to ask a surgeon during your consultation? Any of these questions?
I don't think it should be considered out of line. I mean, a surgeon who's comfortable with all these things should not get offended because you're asking these questions. Okay, but that also goes a lot to surgeon personality, which is not something that I put here. But different surgeons have different personalities. Okay, some surgeons just think like, don't ask me anything. You're coming to me, and I'm going to do what I'm going to do, and that's it. Okay, and that's not my style. That's not my style at all. I like to communicate with my patients. I like to answer all their questions. I like to make sure that they feel comfortable, coming in, and they're well informed. So that's definitely my style there. I want to establish a rapport with the patient, especially when they're coming from out of town. We don't have a lot of time to spend together, so that time has to be valuable time. Okay, and that patient has to feel very, very comfortable with us in a short period of time. So yes, I believe all of these are valid. These are valid questions. These are not insulting questions whatsoever. These are just you trying to get the information that you need to make an informed and educated decision.
Next question. How many people are in the operating room with you during surgery, and is it a set staff or does this change?
Yeah, so I think that's a great question. Thank you for that. It's part of the team, which is I think incredibly important. But I always have a set staff. Yeah, it's always the same team. We've worked together for at least 2 years now. So we all know how we work. We know the flow of the OR, and everyone has their job and they do it well. And they have a lot of experience doing it. So who's in the OR? So of course the head of the table is going to be our CRNA. Okay, it's either Raquel or Carlos. They're both truly excellent. And a lot of people ask, well, why don't you have an MD? Well, I've been working with them for over 2 years. They're terrific. I trust them wholeheartedly. Just to put it this way, I've had my own multiple family members get anesthesia with them. Okay, that's how much I trust them. Okay, so that's the head of the table. Then of course, I have 2 surgical assistants with me and myself, and we're all working to get the case done, as efficiently as possible, and to obtain the best results possible. Of course, we need people to help us though. So there's a circulator, what's called the circulator. She's in the room. She's helping, make sure bringing in all the instruments and sutures and everything that we need, and making sure that everything goes smoothly. And then, this person is not, inside the OR, but is just as important, incredibly important, is then the person that takes care of all those instruments and sterilizes the instruments. Okay. So, people always ask like, who's in the room? Thinking that those are not the only important people in the care that you're getting. Okay, every single team member on the Pure team is incredibly important, and of course, the person that sterilizes your equipment is one of the most important players that we have.
So we know that you may be booked up for 5, even 6 months out. Is it a bad sign if a surgeon has availability in the next couple of weeks or even a month out?
No, I wouldn't say that necessarily. I don't think that in and of itself would be a bad sign. I mean, I think if that's combined with some other factors that kind of makes things look a little sketchy for you, then yeah, okay, it can play a part. But if they're hitting all the points and then that's the only kind of difference there, then no, I wouldn't say that's in and of itself a bad sign.
So even in terms of this whole package safety, if somebody has the COVID vaccine, do you still want them to get tested before coming to our office?
Yeah, as of now, and of course everything related to COVID is fluid and has been changes and has been changing for the past year now. But as of now, we still want people to get the test. Okay, and the main reason is because there has been no literature out there yet to say whether they're able to carry the virus or not, even though they're vaccinated and asymptomatic. And unfortunately, the vaccine is not widespread enough that all my staff has been able to get vaccinated yet. I think once we get to the point that every staff member who wants to get a vaccine has gotten that vaccine, then we may be able to then at that point start to start thinking about not having all those specific rules.
And for out-of-town patients, can they get their vaccine in their city that they're coming from, or does it have to be in Miami?
No, they can do their tests.
Their tests. Sorry, the test.
They can do their tests, where they're coming from. So the rule is right now it has to be done within 5 days of surgery. Okay, so it can't be done like too far out. So it can't be done 10 days before. So it should be done within 5 days of surgery. But you should also be able to get the result before you come in for your pre-op day. So when you come in for your pre-op day, we want to have that result. We want to make sure it's negative before we then continue.
My surgery is 9/28. Can my mom come to pre-op with me? She has questions as well.
She won't be able to come physically. So again, we're still following all the same protocols, all the same COVID protocols that we've been following for the past year, which have worked out really great so far. So she won't be able to come in physically. But if she has questions and wants to see me directly in the day of pre-op, then we can put her on FaceTime and we can do it that way.
We have a few questions really quickly. Can you go back and explain the number 4 on your list?
Number 4. Oh, the before and afters and the style. That one?
Mm-hmm.
Okay. So there were two main points that I wanted to do about that. One is, yes, you want to make sure, of course, that you see their before and afters, but you want to see them also at different kind of time periods. So you don't want to just see someone that they only have on table before and afters. Okay, you want to make sure that there's on table, that there's 6 weeks, there's 3 months, 6 months, and also like some longer term follow-up, say a year or so. Okay, and that's going to give you kind of a more clear picture of how things evolve over time. Okay, and the other thing that I wanted to point out is the style. So different surgeons have different styles. Okay, so for example, I think those have been following me for many years now, a couple of years now. They know that my style is typically kind of a soft vixen look. The Earle curve, upside down heart. Okay, that's my go-to style. And if you like that style, then that fits well. But if you like some style, say that's completely different, then perhaps it's not the best fit. Okay, so that's one of the things that you have to consider. The other thing, which I hadn't mentioned before, but it's of course something that you really want to, is you want to make sure that these before or afters are real patients. Okay, I mean, I didn't say it before because I think it kind of goes without saying, but you want to make sure that these are real patients. Okay, so if you look at our Instagram, so a lot of it are the patients themselves that are sending their afters to us, and they're sending their photos, their beautiful videos, because they're so happy and proud, the way they look, and they're super self-confident and everything else. And so for a fact that these are real patients. Nothing has been worked on, nothing's been photoshopped or anything like that. So you want to make sure that they're real. You want to make sure that you see it throughout different time periods in the postoperative period, and you want to make sure that the style is similar to a style that you like.
So if you have a patient who's predisposed for keloid scarring, does that change your approach or the way you suture, and can they still have regular BBL surgery?
Well, in terms of BBL, for sure, you can definitely have that. It's all very, very small. It's kind of stab incisions.
Mm-hmm.
Does it change the way that I suture? Not really. Does it change our approach a little bit? Yes, because we're more vigilant, okay, after surgery. And so if we feel that the scar even like begins to look a little bit raised, then we may hit it with some steroids, such as Kenalog. We also, of course, tell the patient that they have to be like really on top of that scar. Starting at 2 weeks, they got to start using a silicone-based scar cream such as Silogen, and they got to be, very compliant with their scar treatment, doing that at least twice a day, every single day for the first year. Okay, so compliance makes the world of difference.
Thank you so much. This is very informative. I know you have to go soon, but really quick, can you just talk about vision boards? Do you like them?
Yeah.
Do you use them? Does that actually help you see what the patient wants?
So I'm going to be honest. Overall, I like them. I think they're cool. I think they're fun. I like to tape them on the wall
during surgery
when I bring the patient in. And it shows me that the patient has really thought about things and they put a lot of effort into it. So that's the part that I like. Are they sometimes, not realistic? Unfortunately, sometimes they are. And so and it's my job to kind of point that out. And I'll be completely honest, that is something that I need to work on, because sometimes I don't want to hurt a patient's feelings, and I'm not as brutally honest as I should. And sometimes I'll use words that don't immediately translate, such like I'll say, instead of saying like, there's absolutely no way based on your foundation that you're going to look like this, which I think sometimes can hurt our patient's feelings, I'll say something like, you know what, your foundation is really challenging, okay? And it's going to be difficult to try to get you to look like this. And sometimes that gets lost a little bit in translation, so I am working on that. I think sometimes it does more benefit to the patient and to myself to be brutally honest, even though the feelings may get hurt a little bit at that point in time. But in general, I like vision boards. Try to keep them realistic, okay? So when you're doing a vision board, don't just put up like something that you saw on Instagram that you like, okay? Put up something where the starting foundation is very similar to yours, okay? So if you're gonna show, say, a before and after, you want the before picture to look very much like you do, like your before picture, okay? And then can it be like the expectation can be a little bit more realistic. Or sometimes what patients do, which I think for the most part works well, because if you don't exaggerate, is to take your own photo and kind of just Photoshop it a little bit to something that you think that you would like. And as long as you don't go crazy, like you don't go from say a 40-inch waist to a 20-inch waist, which we all know is physically impossible, okay? As long as you kind of just Photoshop it in a way that's reasonable, that's also, I think, a good thing to do.
Thank you very much.
All right, everybody. Well, I hope this was very, very helpful. I hope everyone got their screenshot there. I'll step away for another 30 seconds or so. Again, I think all of these points are incredibly important. I don't think anyone's necessarily more important than the other one. And you want to be able to hit all these points when you're searching for a surgeon. Okay? All right, so next week, we may not be back actually. Next week I'm on vacation.
Okay.
So no, probably no hump day next week, but the following week we'll be back. And I think that is going to be the big day that we're going to do the big Yanisi reveal.
Yes.
All right, is that right? Yeah.
Yes.
Okay, good. I know a lot of people have been waiting for that. They're like, when is that going to happen, Doc? All right, it's going to happen soon. Okay. So thank you all for joining us. I hope you all have a great week. But we'll see you the following week on Hump Day with Dr.